Well, during this big downturn in COVID-19 cases, now may be the time to catch up with your routine health screenings you may have neglected. And joining us now is Singing River Health System's internal medicine physician, Dr. Matthew Murray, to tell us more about the importance of getting those regular checkups. Dr. Murray, thanks so much for joining us today. And this is something that's really important. And I've looked at numbers, and it seems like as many as 40% of people have neglected care really in the past couple of years.
I would have to say nice to be here. Thanks for having me. Almost certainly at least 40%. I think even without COVID, it's one of the things on the back burner. Unless your primary care doctor reminds you of it, no one's thinking about mammograms, breast cancer screening, everything on their everyday life, just with how busy we are. So just with COVID and all the changes everyone's made, everyone's gotten behind, and I think it can't be overstated how important it is to get back up to date or start even if you never had before.
Sure, that is important. And not just cancer screenings, which we'll talk about, but also regular annual physicals, which a lot of people put off. When should men and women start getting those?
As soon as you turn 18, you should probably see a doctor at least once or twice every year or so. And then turning 30 or 40, that's when routine screenings really become important. Those dates are usually changing. The CDC and United States Preventative Service Task Force are always updating guidelines, and it's really not fair to have the patients think of when they have to do those. It really should be your primary care doctor. So as long as you're going to see them once or twice a year, they should be reminding you, hey, you're due for your mammogram, you're due for this, and get everything back up to date.
And with so many people delaying their care in the past couple of years, whether or not they've just been focusing on COVID so much they've forgotten, or they just didn't want to go into a hospital setting because they were trying to avoid COVID, what has that led to in some cases? I mean, unfortunately, I'm sure you've seen cancer cases that are further along than they would have to be if they were detected earlier.
Almost undoubtedly, we're going to start seeing more undiagnosed or newly diagnosed metastatic cancer from stuff that could have been caught earlier, and that's going to be just devastating. We might not see the results of that for 5 or 10 years down the road. And then blood pressure, people have either not gotten diagnosed with high blood pressure, which is a silent killer, or they've run out of medicines and their doctor's retired or can't get in to see their doctor, or they've just completely forgotten about it. And we've seen increased number of strokes, heart attacks, and other things that are typically considered preventable with appropriate health care, medicines, and screenings.
Okay, hopefully people will get their screenings. And how important is knowing your family history?
Very important. I am very hypocritical at this. I ask my patients, oh, did your mother or father have any medical problems? And sometimes they say, I don't know. And in the back of my head, I'm thinking, well, how did they not know that? And then I remember, I don't know what my grandmother had, or I don't know what my grandparents had. But very important. The big things are premature heart disease, any type of cancer, stroke, things like that. There are other rare things that most people don't have to worry about, but age at which people's parents developed cardiac disease or cancer has a real big bearing on when we start screening. In particular, colon cancer, we start screening for 10 years before your first relative was diagnosed. So if your dad had cancer at age 50, you would start getting screened at 40, which is significantly earlier than most people think.
All right. Well, Dr. Matt Murray, thank you for joining us. Great to have you back in South Mississippi, too.
Wonderful to be here.
Thanks for joining us.